Hi, my name is Charlie Mann, and I am the Specialty Care Coordinator here at Sierra Integrative Medical Center. And I'm going to be answering a few questions for you about, first off, what happens when you actually show up at Sierra Integrative Medical Center as a patient. You will come in and see our front office staff first. We will collect some demographic data on you, and hopefully beforehand we received your medical records from previous healthcare providers. We will put all that together. We will start your patient chart, and then you will go into the process of being intaken, if you will, as a patient here at Sierra Integrative Medical Center. You will meet with several different of our clinical staff. We will draw laboratory samples, blood, urine, those kind of laboratory samples for some of the testing that we will have to do. You will have dark field microscopy done with Chicky and Terry, and we will take a look at your blood in real time, which is what we're doing as part of a study that we're doing right now. You will then meet with Dr. Fong, our Chief of Staff, and go through a very extensive history and background. Those appointments usually take anywhere from an hour and a half to 2 hours, which is pretty unusual in the medical profession that you're going to spend that time one-on-one with a physician in his office. After that, we will determine a course of treatment for you. Those course of treatments can vary from everything from oxidative therapy to chelation to detoxification, and we may use a combination of all of those therapies depending on what your specific needs are as a patient. We don't have just a cookbook that we use. We tailor our treatment plans to each and every patient's individual needs, and we have the capability here to make the patient as comfortable as possible. Everything from sitting up in an IV chair in our main infusion room with a lot of our other patients that are receiving IV infusions, to we have specialty care suites which have beds in them to where if you need to lay down or you need to be in a darkened environment, you need to be in a noise limited environment, we can cater to those needs of the patient also. My job as a specialty care coordinator is I'm the one that will be seeing you at some point in that process of coming on board as a patient here at SIMC, and I will determine what I can do to meet those special needs that you have as a patient. It's a very involved process as far as from our point of view. For you, the patient, we try to make it as seamless and as pain-free, if you will, as possible. And one of my other duties here is to coordinate if we're going to be having more permanent vascular access put into either a PICC line, which is a semi-permanent IV line that would go in your arm, or a infusion port, which is a surgically implanted vascular access system. I would be the one that would coordinate that with the providers that we have locally, that we have agreements with and good working relationships with, to get that done for you. The whole process, if you will, of becoming and starting out as a new patient here at Sierra Integrative Medical Center will take about 2 to 3 days. And then we may be waiting a couple of days more to get lab results back. But that doesn't mean that your treatment isn't going to start on the first day that you're here. We have several different treatments that are broad spectrum across the board that will work for every patient that we see. And we can go into those in more detail once we see you and we can talk about you. But it's not just a come in, run through the mill, if you will. You will be treated as an individual with an individual need all throughout your process of being here as a patient at SIMC. If you have any questions as far as what treatments are available, or any other questions about Sierra Integrative Medical Center, please feel free to leave them in the comments section underneath this video, and we will get back to you with an answer as soon as possible. Thank you very much. Have a good day.